So welcome to beautiful Cape Town and to Equal Partners, the workshop. I can't tell you how pleased I am to see all of you here today, because this is the culmination of months of work. Now, when a bold new initiative like this is launched, it's customary to mention those persons who had the brilliant idea behind the event. Now, there are many of you here who should be thanked for making this week possible, and we'll do that more fully on Wednesday. But let me mention three persons, or three groups of persons, who were behind the concept for this meeting this week. First and foremost, I'd like to mention the Russian Immigration Service. You'll remember that last year, the Russian immigration authorities gave our African colleagues such a warm welcome when they arrived in Moscow at the airport that Tawanda made me promise we would hold the next Public Health Partners meeting in Africa. So here we are in beautiful and gracious Cape Town. Thank you, Russian immigration, and thank you, Tawanda. Second, we have to mention the wise person among the public health staff, and Jonathan tells me it's Roxana, who suggested that before we inflict any kind of human rights training on other NGOs, we should test it on ourselves first. I guess that's what they mean by clinical trials. Or maybe it's self-medication. In any event, that was a wise suggestion, and that is why you, the Soros Foundation staff, are the guinea pigs this week. Finally, I have to mention those persons whose brave vision of collaboration between network programs at OSI have made this workshop possible. You have to understand that collaboration between network programs at OSI is no trivial matter. In fact, it may be something like nuclear disarmament negotiations. But Jonathan, Tamar, Emily, and Yervand deserve immense credit for believing that it was possible and for making it happen. Their enthusiasm, determination, and selflessness were key elements. This will be a week of challenging and thought-provoking discussion, which we hope will generate new collaborations between the public health programs and the rule of law programs within the foundations, as well as between the public health program, the Human Rights and Good Governance program, and the Open Society Justice Initiative at the network level. We believe that health and human rights are equal partners. We believe that expanding access to health can be a fruitful and exciting task for lawyers, and conversely, that legal strategies can help activists to expand access to healthcare and make it a reality. In that sense, it's particularly fitting that we should be in South Africa this week, in the country where an NGO, the Treatment Action Campaign, has successfully sued the government to expand access to HIV prevention and treatment. So thank you for being here with us, and we look forward to a productive week.